Are you feeling like you're stuck in a loop with your health? Like you're managing symptoms, but never really getting answers? Well, if that sounds familiar, you know you're not alone. Today, I want to walk you through 5 signs that show us you a personalized approach to your health. One designed to help you not just get answers, but truly thrive. So, sign number 1. You're struggling with chronic symptoms that just don't go away. Fatigue that doesn't improve, even with more rest. Tummy discomfort that keeps coming back. Recurring joint pain or headaches that seem unrelated to any injury. Personalized health plans focus on understanding the why of these symptoms and digging into what are the underlying root causes of inflammation, what nutrient imbalances may be present, what hormonal shifts may have taken place you aren't aware of and need to be addressed, rather than treating symptoms with just the quick fixes. A great sign is if you've seen multiple specialists and you still don't have an answer. That's often a sign that a deeper, more integrated approach is needed. Sign number 2. There we go, 2. You're tired of 15-minute doctor visits. Do you feel rushed through appointments? Do you feel like you're just being prescribed something without much explanation to get you out the door? Do you leave with more questions than answers? I remember a physician mentor of mine would actually have 8 pockets in his white coat, and he would have a pre-written prescription pad in each of the 8 pockets. He would walk in the room, and within 20 seconds, he was reaching for a pocket to sign one of those prescription pads so that he could see as many people as possible in a short time period. That's not normal by any stretch of the imagination, but it's an extreme version of this time pressure that both patients and physicians feel. MaxWell Care is designed to give patients the time and space to tell your full health story, with longer visits and a comprehensive review of lab work and history. In a personalized healthcare model, we sit down, dig in, and create a plan that makes sense for you, not one based on the averages or assumptions. All right, sign 3. You've been prescribed multiple medications without a clear plan. Well, there is an issue of medication overload. Sometimes the effects of one medication create unintended consequences that then require another medication. We call that the prescription cascade. And it doesn't do anything for the underlying issue, and matter of fact, just creates new issues. The potential side effects and long-term impacts of unnecessary prescriptions are a major cause of disability and death. A personalized care plan focuses on identifying root causes that medications are actually designed to mask. And when possible, decrease your reliance on medications by supporting your body's own natural healing process. Medications can be helpful, but they shouldn't be the end of the conversation. We want to make certain that we're available to use all tools that exist and make sure that you have the best match of your needs for using the appropriate tool for your needs. A personalized plan helps us ask, why is this happening? Rather than just, how do we stop the symptom? It's a lot like trying to find the source of the fire rather than taking the battery out of the fire alarm. All right, sign 4. You want to stay ahead of health problems, not just respond to them. Well, preventive care and health optimization is incredibly important. You may feel okay, but you know that the more times you go around the sun, the more wear and tear is there, and the more future issues like heart disease, cognitive decline, cancer, these things occur more frequently with age because of aging. There's a lot of value of early intervention and advanced testing to catch what is your personal kryptonite. Let's catch issues before they become major problems. Personalized health plans aren't just for people who are sick, they're for people who also want to optimize their energy, their brain function, and their resilience. It's not just about fixing what's wrong, it's also about making sure you stay as strong and healthy as possible in the long haul. Just yesterday in our clinicians conference, one of our clinicians was going over a case of a woman who has very high oxidative stress markers. She feels pretty good. Matter of fact, the initial reasons why she came to MaxWell Clinic were all gone, but she has this persistent problem of too much molecular rusting going on. That's what we call oxidative stress. And she has some very unique genetics. She has some challenges that are very particular to her. And if we address this, it's very likely we're going to markedly decrease her risk of future cognitive decline, cancer, heart disease, hypertension. It's very important to know what's underneath it all and then address those causes. And 5, you want a long-term health partner, not just a quick fix. Having ongoing support is really important. A lot of people feel like they're left to figure things out on their own after they get a diagnosis or prescription. You deserve a dedicated health team to provide guidance, accountability, and continuous adjustments as life and health change. MaxWell Care provides patients with a health advocate, a personalized plan, regular check-ins to ensure you feel supported. Your health journey is not static. There's no 2 journeys that are the same. And that's why having a team by your side, making adjustments as needed, really can make all the difference. So if any of these signs or these 5 reasons sound familiar to you or resonate with you, it might be time to take the next step. Explore a more personalized approach to your health. At MaxWell Clinic, we're here to help you feel seen, supported, and become MaxWell. If you'd like to learn more, click the link below to schedule a free information call and see if MaxWell Care is right for you. I wish you well.